buenos dias. How's everyone doing? Welcome. Welcome to beautiful LA. This is my home, so I'm so humbled to see all the federal government and our partners from all over the country. So thank you for being here. But before I get started, just wanted to quickly give a shout out to my colleague Alberto Pina, who is also in the region. He is a deputy director. So I currently serve as a director for the Region 9 program within the Office of Infectious Disease and HIV and AIDS Policy. And I realize oftentimes when I say I work for OID, people have no idea what we do, right? So let me just take a couple seconds, a minute to just talk a little bit about what our job is and how we fit into the larger role around ending the HIV epidemic. So our office really provides senior or applies advice to the Assistant Secretary for Health and other senior health and human services. So we work very closely with our White House officials, with our other federal colleagues, and you'll hear about them doing some work in EHE. And we really focus on providing advice around policies, communication, and planning, particular focus on EHE, HIV, other syndemics that we'll hear a lot, such as STIs, vaccine. And then Captain John Otamalati, who unfortunately can't be here, but he sends his greeting, is currently our EHE coordinator lead. And his role is really to work across the federal government and with our community partners to really amplify and identify best practice on how we can support all the great work you're doing. And then we also support other areas. We work very closely with the White House ONEP director, looking at the National HIV strategy. We support workforce training, technical assistance. We manage the EHE dashboard. So again, we're here to support you all, and we work very closely hand in hand with our other federal partners. So I think we've all seen this slide a million times, but I just wanted to make sure that we're all approaching this on the same page, that we're here understanding. As we all know, the Ending the HIV Epidemic Initiative was established in 2019. And Steve, you said something that gave me chills. That was the first time, I think, here in LA that we were getting ready to launch the EHE. Then we go home, and a couple weeks later, we're all working from home. So we really had to pivot, and I'm excited to hear all the innovative things you all were able to do because of that. The goal with EHE is to be able to reduce the number of new HIV infections by 90% in 2030. And this initiative was really based on 2016 and 2017 HIV surveillance data. And it's really focused on these 4 strategies, which we are going to hear about all the work you're all doing, looking at diagnosing, treating, preventing, and responding, and really focus on those 54 jurisdictions that we know have the highest burden of HIV. So oftentimes I get the question, well, Michelle, what is the future of EHE, especially with administration change? I'm very proud to say, if you look at the recent president budgets, fiscal year 2025, we could see that there was $593 million in funding that was proposed across CDC, HRSA, IHS, and NIH to really continue to support and scale up implementing EHE. So this really tells us that the administration is really supporting us continue to do this great work. This also represents $20 million increase over the fiscal year 23 going into 2025. So we see major increases across the Ryan White HIV program, Indian Health Services, and also what's very exciting is this funding allows us to be really innovative and collaborate with those that perhaps have not been part of the EHE, but we know are critical, such as our HUD and our SAMHSA that we'll hear about them today. So fast forward, we're going into year 5. As we think about everything we have gone through these last couple of years, COVID, syphilis, Mpox, it never ends, right? I am just so at all with amazing work that you all have done across the nation, across the world. And just to give a little snippet of some of the things, and you'll hear from the federal government, our other colleagues on some of the accomplishments, let's just take a couple things that we've seen in the last couple of years. When we look at diagnosis, you all have been able to diagnose people as quickly as possible, so over 3.5 million people. And we've had to pivot and be innovative where we had to do self-testing, where we have administrated more than 367 self-test kits. So I applaud you all, because these are things that we had to be very innovative. When we talk about treating, when we talk about us reading our levels or our goal by 2030, there are jurisdictions who have already achieved their 2025 goal, particularly when we look at linking 95% of newly diagnosed persons to care. When we look at prevention, I know we've had a lot of challenges with PrEP and syringe service prevention, but we've seen that over 5,500 persons were prescribed PrEP. So we've done some really great work when we talk about prevention. Responding, being able to respond to clusters immediately and being able to take our toolkit to them, to be able to test them, diagnose, get them into treatment, link them into care, or provide them with the prevention services. We have seen the innovation and really the collaboration that we have been able to do with non-traditional partners. I am just amazed with the work that you all have done with faith-based organizations, with other organizations that serve people living in poverty or limited access to health services. So we've really been able to pivot and do some innovative work. So again, I'm really excited to hear from all of you how we're gonna continue to do some of this work. However, unfortunately, as we know, our work is not done. This is why we're all here. We still know that there are many communities who are disproportionately impacted by HIV. I don't have to go down the list because we all know, unfortunately, these communities continue to be disproportionately impacted. So when we just look at geographical areas, we significantly see that our communities in the southern region are disproportionately impacted greater than other regions. When we look at age, we know 1 in 5 young adults are being diagnosed with HIV. 1 in 5. As a mother of 2 boys, that's very devastating because we need to do better. When we look at gender, when we look at race and ethnicity, there are significant disparities that we need to continue to support and continue to uplift our communities. We need to do better. When we look at the funding, as I mentioned, the funding for the fiscal 2025 budget really invests in the syndemic approach of addressing HIV, looking at it through this holistic lens. How do we address HIV by looking at viral hepatitis, STI, substance abuse, mental health? For example, in the budget for 2025, they're proposing a national program to significantly expand screening, testing, treatment, and prevention to monitor hepatitis C. That's huge. And in the proposal, there's also initiatives to be able to collaborate more with SAMHSA and NIH to really bring mental health and substance abuse services to the communities that are much needed. So if we don't address the syndemics that are impacting the communities, we are not going to end HIV. So as I look at the agenda, I was very excited to see that we're gonna be highlighting some of the work you all have been doing to address mental health, substance abuse, because that is a way we're gonna end HIV. And lastly, where do we go in year 5? You know, I will say our HHS leaderships and our principal, along with Captain Otamalati, have been meeting to really look at the last 4+ years to identify what have been those best practices. What are those things we know that work that we need to double up on? We spend a lot of time looking at what works, what doesn't, but I think it's time now to take what really works and enhance that. How do we continue to strengthen partnerships with non-traditional partners? How do we collaborate with academic, research, implementation partners? This is why we are here today. So the work that you all do today is gonna help us inform where we go in the next 5 years. So we're all gonna be listening, we're all gonna be encouraging you, and we all wanna be able to use the information you share here. How do we apply that to the community that we serve? So I'm gonna stop there because I wanna make sure that I have enough time for the panelists. Thank you all so much, and I'm very excited to hear about all the amazing work you're all doing.